We're talking health this morning with Dr. Scot Ackerman. Former All My Children star and Hallmark Channel host Cameron Matheson has revealed that he is battling renal cancer. So he posted about his diagnosis on social media. This is it. In the Instagram post, he said that he had an MRI for some gut issues, and during it, they found a tumor on his right kidney. He says it had not spread to any of his other organs, which is certainly encouraging, despite doctors saying that it had been actually growing on his kidney for nearly a decade. He is expected to undergo surgery today. Now, joining me now to talk more about the signs and the symptoms of this type of kidney cancer is Dr. Scot Ackerman, a local oncologist. Good morning. Thanks for being here. Do appreciate it. How common is this kind of cancer? It's
not one of our top cancers that we see, but it's more common than you think. To put things in perspective, breast cancer and prostate cancer are just over 200,000 Americans every year, and renal cell cancer, kidney cancer, is about 75,000, I think, this year. It's more common in men than women, so about a 2-to-1 preponderance. So if you take that 75,000, we could probably have 47 or 8,000 men, and about half that, 20.
Are there certain risk factors then associated with it? I mean, could this have been really kind of genetics, though he didn't mention anything about any prior family members having had this?
Yeah, most of the kidney cancers are not directly associated with a risk factor, although there are risk factors. Most of them just happen. It's just your genetics, but patients with hypertension or patients that are on drugs for hypertension have been shown to have a slightly increased risk of kidney cancer. Exposure to certain heavy metals like cadmium have also been associated with increased risks of kidney cancer. And so I don't know if he had any of those, but most cases of kidney cancer we can't really step it back and find a causative issue.
It was interesting too because as he revealed, it was an MRI associated with some gut issues that basically found this. But I was reading through some of the symptoms of this, and I was surprised that one of them is a lower back pain on one side that's not associated with any kind of injury. And I could see that maybe people might pass that off as, oh, my back's bothering me, or probably just strain something, and maybe not have that conversation with their doctor. And at the end, it could end up being something more severe.
So as the tumor grows within the kidney, it would cause some pressure, and that would give you this pain on one side, kind of like a kidney stone. It's typically just on one side of the body or not. But most kidney cancers are asymptomatic. Patients don't know they have it, and it's found serendipitously because they've had some other scan done. He had some gut issues of some sort. They did an MRI and they found this. I see a lot of patients myself with renal cell cancer, kidney cancer, and they were having a CAT scan maybe of the chest because they had a cough, and that CAT scan of the chest went down to the kidneys and they saw a funny looking mass there. But when patients do have symptoms, the symptoms that could be associated with kidney cancer are things like blood in the urine, flank pain, back pain, those sort of things.
And is that another reason why it is so important then really to make sure that you're going every year to your doctor, who might be able to pick up on, blood in the urine as an example, if you give a urine, specimen during your annual exam?
Yeah, I think what's more important is to take changes in your body seriously. Not because if there's blood in your urine, you'll see it. You don't wait for your annual visit to the doctor or for he or she to check your urine for microscopic blood. That's good to do as well. But if you have some changes, some new pain that's nagging and not going away, if you're coughing up blood, that wouldn't be for kidney cancer, of course, that'd be for a lung cancer or something, or if you're urinating blood, or if you have blood in your stool, don't put it off too much, because that's what I see sometimes, that patients put this off for months, and then they're at a bad situation where the cancers are more progressed and much more difficult to treat.
So this is very treatable. I mean, you have two kidneys. God bless you. God bless you. It is very treatable, is it not? You do have two kidneys, so I mean, worst case, if they have to remove one, it's not the end of the world.
Generally, kidney cancers are caught early. They're caught where they're just involving the kidney. Sometimes they grow just outside the kidney, and they're very treatable and very curable when caught early. When you have signs and symptoms of flank pain or a mass in your back, that's a little bit more advanced, and those are much more harder to treat. What the science of treating kidney cancer has progressed over the years, and in the past, where we would take out the entire kidney, now we're going in there surgically and just removing part of the kidney. It's called a nephron-sparing partial nephrectomy, where the surgeon goes in laparoscopically with a little scope and just takes out that tumor or just that half of the kidney where the tumor might be. More advanced cases might need some chemotherapy. There's some really cool new immunotherapies that are used if the cancer unfortunately has spread to other parts of the body. And we're using targeted radiation also in patients that have small tumors. Instead of going in laparoscopically or going in and removing that part of the kidney, we use some targeted radiation, proton radiation or stereotactic radiation to ablate that part of the kidney.
Well, we'll continue to follow his progress, and we certainly wish the best for he and his family. Thank you, Dr. Ackerman, for being here. Do appreciate it. If you missed any of this information, by the way, we will post it later this morning on news4jax.com. Just look under the health section.